Good afternoon. I'm Anne McEnerny-Ogle, Mayor for the City of Vancouver, and today we have Alex and Seven Star, our American Sign Language interpreters, with us. It's anticipated that hopefully at the beginning of June we can begin phase 2 of the governor's reopening plan, which would include the ability for restaurants to reopen at only 50% of their capacity, and tables would be capped at parties of 5. Yesterday, the governor released a set of requirements that restaurants must follow if they're planning to reopen for dine-in service under phase 2. The governor's guidelines lay out 13 criteria, including safety and health requirements, that restaurants will have to comply with in order to reopen. I wanted to give you a brief overview of those requirements, and we'll post a link to where you can find the complete guidelines online. The requirements for restaurants to reopen under phase 2 of the governor's plan include hand sanitizer. It must be available to all employees and customers. Restaurant tables must be spaced so that the guests at one table are 6 feet away from the guests at another table. Salad bars and buffets are not allowed. Menus and condiments must be single-use only. Bar seating is not permitted, and it's strongly suggested that customers wear a cloth face covering anytime they are not seated at a table. In addition, restaurants will be required to keep a daily log of customers' contact information for the purposes of contacting guests, if necessary, to provide notification of any positive COVID-19 exposures. Early testing is critical to slowing the spread of COVID-19, and yesterday the Clark County Public Health issued a press release urging anyone who develops symptoms of COVID-19 to contact their health care provider about testing as soon as possible. Clark County Public Health has published updated guidelines to healthcare providers urging them to test all patients with COVID-19 symptoms. The CDC recently expanded the list of symptoms consistent with COVID-19, and the updated symptoms include a cough, shortness of breath or difficulty breathing, and at least 2 of these symptoms: fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. People with these symptoms or a combination of symptoms should call their healthcare provider to request testing. It's important that people get tested as soon as they begin experiencing any of the symptoms, and most healthcare facilities now offer virus testing. People who do not have a healthcare provider can contact the following facilities to request testing: Legacy Go Health in Hazeldale and Cascade Park, Providence Family Medicine in Battleground, Rose Family Clinic in Vancouver, and the Vancouver Clinic in various locations throughout Vancouver. Testing should come at no cost to the patient, whether they have insurance or not. The state insurance commissioner is requiring insurers to waive co-pays and deductibles for COVID-19 testing. Across the state, some fire departments have noticed a decrease in the number of calls from people with symptoms of heart attacks, strokes, and other serious medical issues. So our Vancouver Fire Department would like to remind you to please call 911 if you are in need of emergency or medical care. Some people may be reluctant to call 911 during the pandemic out of fear of getting COVID-19 or because they're worried about overwhelming the emergency response system. But please know that our fire department, our ambulance service, and our hospitals are prepared for all medical emergencies during this time. So they want to remind you to please call 911 immediately if you have an emergency for medical needs or any symptoms of a heart attack or stroke. It is vitally important that we take care of ourselves and our loved ones during these especially stressful times. Take care of yourself. Please let us know how we can help you. Take care.